and I'd like to introduce Ed Long. He's been a Caring House volunteer and on the board of directors since the very beginning, and it's his involvement in this that has kept it going as long as it has, and we really appreciate his help. So Ed Long, thank you.
I'm really excited. We started working on this project. I was a lot younger, and our first meeting was actually in a phone booth. We have we have over 100 people here today. We had a community meeting a couple of years ago. We had 30 of us together. So it's spreading. People are getting the idea. They understand what Claire is talking about, what Claire has been hoping for our community for a long time. I know because we've talked about it. One of the confusing things that people face when they try to get their hands around Caring House is the distinction that Claire was making. We have absolutely wonderful hospice service providers all across the country and in the South Bay. And they visit people in homes, they visit people in assisted living facilities, they visit people in nursing homes. They provide, they're like a visiting nurse, but there's a doctor, there's associates, wonderful services that are being provided to people who are dying. Question is, where are those people living when they receive their services? Now, we hope at Caring House that every one of us and everyone in the South Bay will be able to stay in their own homes and be surrounded by family who can support them there and have their hospice services delivered to them at home. We've looked at the numbers, however, and that's just not the case for a lot of people. A lot of people end up out of their homes at the ends of their lives for the reasons Claire cited. Caring House is going to be the place. We think it's actually the next best place to being at home, and for some people it will be a better place than being at home because it will be a place where people can, where caregivers can relax and focus on connecting with mom or dad or their aunt or their friend. Where one of the things that we have a wonderful model that we've spent a lot of time with in Syracuse, New York, where Pat and I are from. The model there that I learned about because of my dad's hospice care, with the volunteers that are involved. You know, there's this issue in care facilities about call buttons and responsiveness. Well, you know, if you staff the facility properly, if you have volunteers, someone rings that call button, somebody's there within a minute, they start to understand that they're not alone. I mean, one of the big fears of people in a care facility is that they're alone and no one's going to come. The experience of the facility, Francis House in Syracuse, is that people, after a while, realize that, yeah, there's somebody there for them. Well, we're going to do that at Caring House. Because of my bad training, I have to do PowerPoint. So I'm going to direct your attention to the screen, if I might, if I can take you through a few slides. There are only 85 of them. Pat told me I had to cut it down a little bit, but actually there are only 8. Anyway, a little overview of the Caring House project. When a resident comes to Caring House, they will have already selected their own hospice service agency. We have wonderful agencies serving the South Bay, and they will come with an agency. Our goal is to have 6 private rooms. Now, based on facilities that we've explored, the average stay is an issue. As Claire mentioned, the average time on hospice is about 19 days. Well, the facilities we've talked to, it seems like they have people that are more attuned to the need and value of hospice. So the average stay we're figuring is about 30 days. We're talking about people's lives at the end. Okay, and how do we make those lives better? Charges. We're going to charge people based on the cost of operating Caring House. Now, not everybody can pay that. We do not want to exclude people who can't afford to pay that. And that's why we're a charity, and that's why we're out raising money. We also don't want to have someone come and be able to pay for a month and run out of money and then have to be discharged. We will never do that, but that's why we're a charity, and that's why we're raising money. If we were a private business, we couldn't do that, okay? That's why we need this to be a charity. We'll care for the people who can afford it and people who perhaps can't. Staffing. I went to a wonderful facility a couple of weeks ago. It's assisted living, a large upscale assisted living facility. Their staffing ratio is one caregiver per 7 residents. Well, with their population, that works. With our population, that won't work. Our staffing ratio, including volunteers, it'll be 1 to 3. It's a pretty darn good ratio, staffing ratio. They talked a lot about Medicare benefits. We're not getting anywhere near any government money. First of all, it wouldn't pay for what we're doing. And second, we want the hospice service providers. They can get Medicare funding for what they do quite often. Insurance will pay for hospice services. So that's where the hospice money will come from. We're not looking to the government to pay for Caring House. Our revenues, I mentioned, are going to come from charges and from donations. Our project is by our community. We have more than 100 people interested in making this happen. More than 100 of you could be here today. Our project is for our community. So we're doing it ourselves here in the South Bay. The steps. Well, we've been at it a while. We kid about that, but we're picking up steam. Step number 1 is to get organized. So we're organized, we're incorporated, we have a board of directors. We even have our insurance agents here. We even have liability insurance, so how about that? We have a 501c3 determination from the IRS. We're able to accept tax deductible contributions. Next stage is recruiting volunteers and raising money. We've been recruiting volunteers for some time. And today's lunch was put on by volunteers. Our core group of volunteers has been working on our project, and we're trying to grow that. Raising funds, I'm going to talk a little bit more about that. Why are we raising money? Well, we're raising money so we can buy a house. We've gone around and tried to rent places, okay, and it's never worked out. And one of the reasons it doesn't work out is if you're a private homeowner and you're looking to rent your home, and you're thinking someday you want to sell it, it kind of hurts the marketing if people have died there, okay? We don't find private owners who are really interested in renting to us, okay? So we need to be in charge of our own destiny, in charge of our own property. We get the home, we renovate the home. We get a license. We get a license from the Department of Health Services, Social Services, excuse me, and it'll be a license so everyone can be on hospice in our facility. Everyone will be. We'll hire and train staff, and we'll welcome residents. So right now, our hurdle is raising the money to buy a home. I should have mentioned, I'll stick around afterwards for questions, but we're a little tight, okay, on time. So raising funds. Right now, if you brought your checkbook, leave it in your pocket. Okay? We don't want anybody to write a check. What we are trying to do is get to the point where we have sufficient pledges of support. Pledges of support of a cash donation, or we even have a novel program where people can lend us money. So for instance, if you didn't get any of the Facebook stock, you potentially could be an investor in Caring House. Now, you have a lot of paper here, okay, and I'm not going to take you through it right now, other than to tell you that we've summarized the pledging arrangement. Again, we're not looking for cash, we're looking for pledges. The idea is when we get to the point where we've reached or close to our target, which is $1 million, that's when we're going to call on the pledges, and we're hoping that's going to be later this year. Okay? The lending part, if you're interested, we'd be glad to talk to you more about it. It does bear interest. Okay? The way we deal with the pledges is through these pledge cards. So if you are of any mind to make a pledge today, that would be lovely, but if you're not, later's fine. It's a pledge card. If you'll take it out, I want to look at it a little bit with you. It gives you an opportunity to pledge to do any one of a number of things, even a combination of things. So first, if you would pledge to be a volunteer. One of the things that makes the facilities work so well is the cadre of volunteers that help from in the kitchen to responding to call buttons to maintenance issues to answering the phones. We also have a place to pledge to contribute money and also to lend money. Now, you may have seen as you came in, there's a little Lego house under construction by the door. Well, it turns out that if you wanted to leave your pledge card, please leave it in the house. Because the house is 49% done, and that's where we are on our fundraising. So every additional $1,000 that we raise is going to be one more piece for the Lego house. Anyway. It's we get to use my toys. So there's the house on the left as it presently stands, and there's the goal. And we've got to go from we've already raised $490,000. It's not too shabby. It's a combination of cash and loan pledges. We're going to raise that money. We're going to create Caring House. Continuing to recruit volunteers after the money is raised, after we get close to that $1 million. It's really kind of interesting because we've been talking in the community. Volunteers, we're going to have to acquire a home. Okay? Well, we've already talked to 2 real estate agents who have told us that as our buyer's agent, they will waive their commission. Okay? So there's a volunteer. We've also talked to an escrow company that says they will waive all the escrow charges to make the deal get done. Okay? We've talked to contractors who say, I can't wait to come on in there and help you do this, and we won't charge you, or we'll do it at cost. So the community will be there when the house is there. So we got to pull it together to create the house. Obtaining the license, hiring and training staff after we renovate the home, quite doable. It's been done in other parts of the state. We don't have this in LA County. Okay? They have it in Ventura County. There's a home that just opened up there. Why don't we? Why don't we? We need to. So let's do it. Welcoming residents. I go back to my first exposure to what Claire has seen and was my dad, and I mentioned in Syracuse. And my dad had lung cancer, and he was on hospice, and he received wonderful attention from the hospice service. It helped him a lot. Our commitment to my dad was, you'll get to stay at home as long as we can make it happen. And there were 4 adult children then, and my mom. But my mom was living with my dad. The children were spread around the country, so we would take turns going for a week to Syracuse to be with mom and dad, mainly to be with dad for the nighttime because he was awake, and it was a kind of a danger time, and otherwise mom was kind of exhausted. Anyway, this went on actually for some time, and there came the day when mom said, I'm not sure we can do this anymore. I want to I want to show you someplace. And she showed me Francis House, which was exactly what we're trying to do. We went there. I walked in. I don't know, maybe it was a trick, but they were actually baking bread. There were volunteers. It was calm. There were family members there. It was peaceful. They showed me their little call bells. Every person had an individual call. It was a bell, actual bell, and they all sounded different. Now, at the time, they had 6 residents. They sounded different. So the staff and the volunteers responded to the distinct bells, and boy, did they respond. And we kept going there, and Pat and I went there not too long ago, and they have so many volunteers. They have a woman we bumped into. She was cleaning the restrooms. Now they've grown. They now have 16 beds. So she was cleaning the restrooms. We said, wow, you do that? She said, I love to clean. They have 300 active volunteers. for a facility the South Bay has about 500,000 people the way we count it. Syracuse has about 500,000 people. Kind of similar. They've got a facility. Why can't we have a facility? We got the people. So Caring House is all about that. And I invite you to keep up to date. Give us your email address. That little card trick, to get you to participate in the drawing, that was also to get your email address. We're going to build this. We're going to make this happen. It's by our community, for our community. Thank you for being here. Thank you.